Hi everyone, it's Crystal Sayers from New Beginnings Health and Wellness. Today I'm going to teach you about the Cortices technique that we use in Body Talk. It is one of the most important techniques, and it would be really helpful for you to learn this so you can do this on yourself and your family and your friends. And first thing we're going to talk about is how it can benefit you. So the benefits of the Cortices technique: it takes the body out of fight, flight, freeze mode. So if you're dealing with a stressful situation, what this does is it actually takes you out of the stress mode and puts you into a more calm, relaxed state, which actually allows the body to heal. It also improves brain function and mental clarity. It improves communication between the left and right hemispheres of the brain. So, one thing that happens when we are stressed out or even through electronics is we have a breakdown in communication that can happen because of interference within the brain. So, this kind of gets the two hemispheres working together again and communicating better. It also increases a sense of relaxation and well being. So that's really great, hey? It helps the body and the mind manage and process stress. And it also supports body talk sessions. So if you are having body talk sessions, your body will actually respond quicker and the healing process will be a little bit quicker as well. And I've really found that the Cortices technique has helped me tremendously. It was one of the first things that I learned before I even got into Body Talk. And what I found was that I would wake up in the morning and I would have less brain fog. So I know a lot of people struggle with brain fog. This is a great technique to do for that. It also is great if you're having trouble sleeping. It can help you sleep at night. It will help relax the nervous system. And even if you're like at that 2 or 3 o'clock lull in the afternoon, this will actually help wake you up and give you a little bit more energy for the rest of the day as well. So let's go into a testimonial. Actually, I'm going to show you a couple testimonials about what the Cortices technique can do. So this is a pretty amazing one. So the next two testimonials actually come from John Beltime's book, the Body Talk Access, and it's called A New Path to Family and Community Health. So it describes a full access program, which I'm not going to talk about in this video, but it is really incredible. So these are a couple testimonials. The first one is from a lady named Anne in Germany. Several years ago, I took my first Body Talk class with Dr. Marita Kufe in Hanover, Germany. When I returned to my home in Hamburg, I right away decided that I must try to use some of the Body Talk techniques that I had just learned on my patients. I'm an occupational therapist and was working at the time in a coma ward at a hospital in Hamburg, Bremfield. I didn't know quite where to begin, so I decided to do the only Cortices technique on 10 of the patients. I then went home at the end of my shift. The next day, when I arrived back, there was a terrific commotion because 6 of the patients had awakened from their comas. These were diabetes patients and accident victims, some of whom had been in comas for many months. They still had diabetes and they still needed a great deal of recovery from their injuries. But they came out of their comas and were immediately transferred off my wing for further treatment. Wow, that is so amazing. So the next one is from North Dakota by a lady named Marcy Hettich. I had finished my first Body Talk class and wanted more proof that Body Talk works. I read about the German nurse whose coma patients had regained consciousness after receiving cortices. So I decided to do the technique on the coma patients I see in the ICU at the hospital where I work as an occupational therapist. Over the next 7 months, I did cortices on 10 coma patients, and 9 of them regained consciousness that same day or the next. The results have been so amazing that I continue to do cortices on neuro patients such as stroke, head injury, and coma victims. I have observed that if cortices is done on patients as soon as possible, they recover more quickly and require less rehabilitation. I have seen severe stroke patients regain function, and in many cases, I am convinced that without cortices, they would have been going to a nursing home instead of back home to their families. Wow, that is really, really incredible. So now I'm going to teach you how to do the Cortices technique. I'm just going to stop the share. Okay, so the first thing you're going to do, it's very simple. You're going to just touch this with a closed hand, the back of your head, and that is where the occipital lobe is. So we're going to actually be covering every part of the brain. So you're holding that with a closed hand, and then you're going to take your other hand and you're just going to lightly tap. So the reason why we tap is because we're asking the brain to facilitate the changes, and you want to make sure that you're covering both the right and the left hemispheres. Just a light tapping, no need to hurt yourself. And some nice deep breaths, usually 2 breaths per hand movement on the head. And then we tap over the heart, and the heart saves and stores the information. And then we tap over the enteric brain or the gut brain, which actually helps to assimilate and integrate the information. And nice deep breaths. And then you're just going to caterpillar up 1. So you're just going to move your hand up a little bit, and we're tapping again, nice and light, nice deep breaths. And then we're going to caterpillar up again till we cover the whole brain. Oh, feels good to breathe. And then we're caterpillaring again. Nice deep breaths. You're doing great. And then we come right forward. Make sure you cover right over to the eyebrows because our frontal lobe is right in that area. And we're just taking some nice deep breaths. You can tap behind, you can tap on top, it doesn't really matter. All we're doing is we're actually creating an interruption in the electrical circuitry of the brain, and we're asking the brain just to fix anything that needs to be resolved. And as we breathe, the brain is scanning for any issues throughout the body. So just remember, every time you take a breath in, it's an opportunity to take life in fully. And when you take a breath out, it's an opportunity to let go. So, what do you need to let go of today? Just think of that. Okay, and then we're going to move to the sides of the head. So, one hand goes on the side of the head, just above the ear. And you kind of want to make sure sort of the heel of the hand is sort of around the temple area. And make sure your hand is closed. And a nice deep breath and tap. This is really great for kids. If you have kids who are struggling with anxiety or stressed out, or they're having difficulty focusing, this is a great technique to do. It is incredibly helpful. All right, and then the other side, and just tap lightly. And if you're really stressed, try and do this about 3 or 4 times a day. So this really can help ease the stress a lot. It brings the breathing back in as well. So good. Okay, and that is the Cortices technique. Thank you so much for watching. Have a wonderful day. Bye for now.